afternoon, everybody. I'm really excited to be here in Seattle. It's my first trip to Seattle, and it's been wonderful. And I'm excited to be here with you guys to talk a little bit about crisis communication and reputation management and the social media cycle. When it comes to situations that threaten our reputation, I think often our first instinct is to sort of shy away from it and not communicate and hope that it just kind of all goes away, disappears into thin air, sort of like, if I don't acknowledge it, it didn't happen, it never happened, let's not talk about it. Unfortunately, that's not really the way the world works today. And so today I want to share with you why communicating during a crisis is so important, and being prepared for a crisis communication is essential to mitigating any sort of effects you might feel from any sort of crisis that might rise up within your organization. So regardless of industry, all organizations face risk, and the stakes can be really high. These three risks, public safety risk, financial loss, reputation loss, are all critical, and they're the most likely to cause some sort of issue within an organization. When we're talking about public safety risks, we're talking about things that are risks to people's health, loss of life. When we're talking about financial loss, we're talking about risky contract deals, as well as loss of business. And when we talk about reputation loss, we're talking about a loss of trust and confidence in your community and in the public that you serve. If anybody wants to share, by the way, I like kind of informal sessions, so if you have any questions as we go along, feel free to ask. What kind of risks have your community health centers faced? Anybody?
We had a provider, unfortunately, about a year ago, die in the office. Was a bike to work, had a heart attack, but didn't recognize it until the next patient appointment provider was there. And unfortunately, the rumor started. It's a challenge to address.
Right. And so that's why I emphasize that it's always ready, even if it's just a generic message, to be ready to communicate, because you never know when something like that is just going to happen. It's so bizarre, you don't think it's going to happen to you, but it does. Other things that affect community health centers are that actually all of these risks can affect community health centers at the same time. So for instance, something goes wrong when a physician or nurse is seeing a patient. The patient gets angry. Maybe they don't feel like they were helped enough, or maybe they feel like they felt more sick after they left. So that's sort of a public safety risk. And then they go and they share this information on the internet via social media, and then their friends hear about it. So you're losing a little bit of reputation there. You're getting hit where it counts on your reputation. And then that can be followed by financial loss, because you lose business if people don't have confidence in what you're doing. So here are some of the health center headlines that have come across my desk just this year. I do a lot of the media monitoring for NAC, and that includes monitoring what's going on Twitter and Facebook, as well as getting news items that come through my email and through another service that we use that monitors email or monitors news items. And as you can see, health centers face tons of risks, and it's important to note that one bad apple spoils the barrel. And even though these health center headlines were pretty local, so the news media that picked these up were local, they can tarnish the reputation of a 50-year-old program. So for instance, like the lawsuit says Bronx Health Center turns away patients with physical disabilities. That was actually in the New York Times. How many of you read the New York Times? Right. Everybody reads the New York Times. So if you had looked further within the local section of the New York Times, you would have seen this. And so I'm sure you guys are also aware that because we receive federal funding, we're held more accountable because federal funding equals taxpayer money. And so if there's some sort of indiscretion, if something gets out there, then and a taxpayer decides, oh, I can't have this is horrible, there's public outcry, followed by investigations into, how effectively you use the money that's given to you from the federal government. How many of you are on social media, like your personal accounts? Okay, so most of the room. How many of you get your news items from your social media accounts? I follow the Post, the Times, Huffington Post, Christian Science Monitor, you name it. It's coming through my Facebook and my Twitter feed, both my private account and my public account. So social media has changed the game not only for journalists, but also for the public. The way we receive our news, how quickly we receive our news has completely changed. Social media delivers news 24 hours a day, 7 days a week, and has created the citizen journalist. So anyone now with a smartphone and a free account can be a source of information to journalists. All they have to do is snap a photo, send a tweet, and it's out there for everyone to see. That's if they're public accounts. So these days you can count on social media happening or social media breaking news before the news media actually gets there. This is a really interesting story. So how many of you know how the news about the plane on the Hudson broke? Anybody? So it actually broke on Twitter. Some guy was on a Staten Island ferry, saw the plane land in the Hudson, snapped a photo and said, "What is going on? Why is there a plane on the Hudson?" And then the media showed up. But before that, no one had a clue. Before anyone could figure out what was going on, before the poor passengers could get off the plane, this was posted and it was out there. And that is how the news broke. Are you guys keeping up with the Farmer Bro? This conveniently showed up right before I came here, so I had to throw this in here. So the Farmer Bro is an interesting case. This is a CEO of a pharmaceutical company, and his company bought a life-saving drug that's for folks with an autoimmune disease. And then as soon as they bought it, overnight, the price of the pill went up from $13 to $700, a 5,000% increase, which was just crazy, astronomical. So shortly after, the New York Times wrote a piece about price gouging and the drug market. And they interviewed the Farmer Bro. And his response was, "I don't understand why our company is being criticized for this." That was his response to the New York Times. So later, a health reporter followed up via Twitter and said, "Let's see if we can get him to tell us why they've raised the price to this drug." His response to that reporter was, "You're a moron. You don't understand." This is all going on online. People are now catching on. People are retweeting, asking the same questions to him, and he's not responding. He's just sort of fighting back. Then Hillary Clinton got in on the game and decided that she was going to tweet about price gouging and how she doesn't agree with it and she has a plan. That actually sent stock prices for bio stocks down that day. And then after that happened, the Pharmaceutical Association decided that they wanted to distance themselves from this pharmaceutical company. So that escalated really quickly, right? I mean, that was 48-hour period. That's how quickly this all happened. And he's still in the news. Apparently he tried to donate money to Bernie Sanders. Bernie Sanders wasn't having it. I mean, it just keeps getting worse. But that's just to show you how a company's actions and failure to act and to communicate have tarnished not only the company's reputation and the CEO's reputation, because this will follow him for a long time, but also added another black mark to the pharma industry, which is already facing backlash for other practices, right? So what are the key mistakes in this case? Lack of preparation. The organization bought this drug overnight, raised its price, and never communicated anything. Not to the medical organizations, not to the public, no one. They didn't release any sort of press release or anything. It was really interesting. The other thing is they also failed to listen to what was going on in the environment and learn and research what was happening. Because had they actually listened to what was happening in the environment, they would have noticed that this is not the time to raise the price of a drug, 5,000%. It's election season, and this is going to be a big talking point. People are already upset. They don't trust corporations and big organizations because they feel like a lot of executives are getting rich while people sort of in the middle or at the bottom are suffering, right? So that people felt like the executive of this company was getting rich at the expense of someone's health. But they also would have learned that, yeah, it's a big talking point right now, the regulation of drug prices or the lack thereof. So it was key for them to prepare and be ready for backlash. Anybody who had actually taken the time to look would have noticed that there was going to be backlash and they should be prepared for it. There was a lack of communication. Despite the CEO continuing to put his foot in his mouth, no one ever stopped him. No one ever said, maybe you should not tweet for a little while. Maybe you're not the best person for an interview. Let's back up a little bit. It was clear he didn't have any sort of talking points, no key messages, nothing. And they actually failed to put a press release out until the 10th of October. It was almost 2 weeks later that they decided to address this situation, which was really interesting. And then I also want to stress with lack of communication that sometimes your CEO, and I'm sorry for the CEOs and executives in the room, but sometimes your CEO and your executive is not the best messenger for your message. So a 30-year-old ex-hedge fund manager is not the best person to deliver a message about the increase in a life-saving drug. Just not. He's going to come off as just another Wall Street guy trying to make a buck. There was also a lack of action, right? So like I said, they didn't do anything to stop this guy, and they still haven't. They have their own official Twitter account. They have not posted anything about that. There was just a lack of doing anything at this point. And that all led to the big crisis that they're having now. And even though they have continued to say that they actually are going to donate some of this drug to folks, it's too late. I mean, they've been tarnished in the court of public opinion, and the public is not quick to forgive and forget. They will remember this for a long time. So, failing to plan is planning to fail. I can't stress that enough. In this environment, the wisdom is to be ready, be proactive, not reactive. You do not want to be reactive. And what can save you is having a game plan. So, developing a crisis communication plan. And actually, on your tables, I've left templates of a crisis communication plan that we have created. And if I don't know that I had enough, but I can certainly email it to folks. So when you're creating a crisis communication plan, think of it as a guide for your organization when there's a crisis. Being ready can help mitigate some risks. And when you're developing, consider the purpose of the plan. Let people know why this is essential. Also, when to use it. A crisis communications plan is important, but it's not always active. Know when you need to activate this sort of tool. You're not always in crisis, so no need to always have it active. Crisis communication. Develop a crisis communications policy, and this is the piece that you would share with your entire staff and have them read it, possibly once a year, so they know what the policy is on crisis communications. And it should tell your staff who's in charge, who takes the lead when there's a crisis, who's the spokesperson, your rules about talking to the media. It should indicate all that information. Create a crisis communications checklist. make sure to follow this checklist. When you create it, include information like, again, who's in charge, who's the spokesperson, when do you contact your board, when do you contact the media, when do you post things to social media, when, all of those different steps, just so that you don't forget something when you're going through this. Because ultimately, you want to plan for this stuff on a sunny day, not in the middle of a storm. But sometimes when you're in the middle of a storm, you forget things, and so this is a really good, helpful guide. Create a contact tree. Who needs to be contacted? Not everybody on your staff needs to get a phone call in the middle of the night if something happens. Maybe just your CEO and whoever's going to be the spokesperson, maybe your top leadership, and then go down from that list. Other elements you should consider are training resources. These are how-to guides. They're also training your spokesperson, media training them so that they're ready to step out in front of the press if need be, and they know your key messages. So everybody has values and a mission that they adhere to, right? Those should be in your key messages. They should tell your story, and your spokesperson should be ready to tell that story if need be. Pre-approved messages, again, you all have values and missions and things like that, so there's certain things that you can say. There's other things too that you can do as far as pre-approved messages. For instance, for Twitter, I just want to acknowledge as soon as possible that I know there's a situation and that we're dealing with it, or that we're investigating and looking into it, but we know there's a situation. That's what people want to know. I've heard you, I understand there's a problem, and we're going to do something about it. And you can do that in 140 characters. And just let people know that you're the source of official information. You really want to do that, because any rogue account out there can start posting things, and maybe it's not very accurate. But if you make yourself the official source, people will look to you. Have a decision tree. Who's the lead during a crisis situation, and who makes the decisions in a crisis situation? If that person's out of pocket, who's the second person that's in charge? And then put the plan to the test. Try to do this annually, particularly with the people who have to take the lead, just to make sure it all works well together, that you haven't had any changes, and to fill in any gaps that you might have. So listening, I talked a little bit about this. You need, even if you're not online, how many of your organizations actually have official Facebook and Twitter accounts? Anybody? Okay, so a lot of you do. Great. So are you guys managing them? You have someone dedicated to that, to monitoring and managing? Okay, great. So you should do a lot of listening online, because this can help you mitigate a risk before it even becomes one. So people love to complain online. If that's what Yelp does, that's what Glassdoor does. People love to share their negative experience. So I advise people always to listen. Even if you don't have an official Facebook or official Twitter account, just go online, Google yourself. I promise you will pop up. I have had many community health centers come across my desk in a tweet that came from Yelp. And then sometimes I notify people if it's negative, and I let them know that this is something they have to address. But yeah, it's interesting. NPR just did this article about Yelp and how now Yelp is moving from just restaurants and entertainment and hotels to rating doctors. And so if you're listening online, you can see what people are having issues with, and you can help to address those issues. There's also an online source called Glassdoor, and it's an HR resource. So Glassdoor, I can go there, and if I'm looking for a new job and I want to see what an organization pays their employees, the pros and cons of their culture, I can go there. And ex-employees and current employees will have posted some sort of review. And that's a good place to go too if you think there might be an issue arising among your employees, to go sort of see what people are talking about when they're talking about working for you. And you can use that information to mitigate the problem before it becomes a really big issue. So this is the crisis communications cycle. And like everything in communications, it is just that, a cycle. You know, you do it all, and then you see how well you did, and then you repeat. So when you're responding, again, you want to acknowledge the situation. Be candid. Be as transparent as you possibly can. Let people know that you have heard them. That's all they really want, and that you're going to be doing something. Reassure them. Investigate the problem, and then let people know what you're doing to fix it. You know, if it's an employee problem, if it's an education problem, or something like that, let them know that you're looking into it, you're fixing it. Recovery. You got to continue to manage the organization's reputation. You have to demonstrate that you're responsive and committed. Again, keep communicating. Be candid with your public. And don't forget your internal audience, your staff. Your staff needs to also be aware of what's going on. And make changes as, if you need to. Figure out where those changes need to come in and make those changes. And then, once you have done all of this, you go back to readiness, which is what we talked about before, being prepared. And, during this whole phase, I will also say you should probably do some media monitoring. And that can be as simple as setting up a Google alert for certain keywords that you can get to your inbox. And that's always great because you can see what the press, if you're in the press, what they're saying about the situation. And then you can also correct people if you see something that's not correct, any data, any information that they're sharing that isn't correct. And then take all of that information once you've gone through the cycle and fill in the gaps, actually sort of look at your results, how well you did your organization do everything they needed to do, and did it go well? And then once you do that, you start all over again. You have this crisis communications plan that's been improved upon because you've already been through it once. This is a great response. So not all crisis situations are negative. It's a good way for you to communicate. It's an opportunity for you to tell your story. This is an interesting case where the Country Doctor Community Health Centers received a post on their Facebook alleging that their physicians are okay with their patients not vaccinating children, or their parents not vaccinating children, which is completely contrary to what the health center does. And so they went through and explained their values and how they approach their patients with education and advice and encouragement. And then they talked about how all the children, 90% of the children that they see have received all their vaccinations by the age of 3, the ones that are recommended by the CDC. And that's well above the national average. So instead of shying away or deleting a comment that was on Facebook without addressing it first, they went ahead and created, and it's a long post, but it's really interesting, and it's in your, I encourage you to read it, because it's a really well done post about their policy. It talks about their policy, their values, working with their patients to make sure they make educated decisions. But ultimately, it's up to the parent, right, to make those decisions. We can educate and help as much as we can, but ultimately it's up to the patient. So they did a really good job responding to this. It's a hot button issue. It could have gone way, way, way further, and could have resulted in some reputation loss and public safety sort of issues, but it didn't because they nipped it in the bud right away. Here's another one. This is reassurance. So St. John's Mercy Medical Center. This is a little older. This is the public personal page of a OBGYN at this medical center. And she was frustrated, understandably so, with a patient who was late for her induction to have the baby. Late for 2 hours late. And apparently the patient had been late to all of her appointments. But she posted this on her Facebook page, which is a big no-no. And instead of her colleagues saying, maybe you shouldn't put this on Facebook, they joined in the conversation. And it's kind of insensitive, because then the physician reveals that this woman had a stillbirth, and that's why it was sort of an issue getting her into the office. Now, I'm not from Missouri, but I know all of this patient's information now, and that's a terrible thing. But what this sort of demonstrated was that the organization had failed to educate their physicians on their social media policies and what's appropriate, what's not appropriate. It's clear they need a HIPAA refresher. I mean, there's a couple of things happening here, right? So the organization right away posted that their physician leadership was looking into this problem. They realize it's an issue, it's not part of their values, and they're upset. And so they're going to go through a process of seeing what they could do better. And then later, they posted again and said, they value the dignity and privacy of their patients, and reassured the public by saying, we can't talk about what we did for discipline, but everybody who's involved has been disciplined. And that they are going to start educating people on the use of social media and go over some other privacy sort of assurance education. And here's our final case study. This is Odwalla. They're a juice company. They don't pasteurize all of their juices. And so there was an E. coli outbreak. And right away, the organization pulled their products off the market, and that's a $6.5 million loss. That's huge. But because they did it right away, people later on were more trusting because they didn't hesitate. They realized this was a health risk. We need to do it for the people, regardless of how much money we lose. They accepted responsibility right away. They offered to pay medical costs, and then they continued to update their public through press briefings, and they even took out newspaper ads explaining what happened. Maybe people who have their juice didn't realize it was unpasteurized. Maybe some of them don't realize what unpasteurized means. And so it was important for them to explain all of that. They recovered, they paid their FDA fine, and they've refocused on rebuilding customer trust. And then they also talked about how they were going to fix their quality control and safety issues. And they recovered quite well. You still see them on the shelves now. And actually, they were bought by Coca-Cola a couple years back. So they did bounce back. So this presentation, I hope that you've gotten some insight into why it's important to prepare. Oh, yes? Oh, no, it's fine.
Going back up, so they called daily press briefings with the newspaper and the TV station and
They did.
Local news?
They did. So this is actually a little bit older case. So it was harder for them. Back then, social media wasn't what it is now. There probably was Facebook. I don't think there was Twitter. So it was more protocol to do the daily press briefing kind of thing. And it doesn't mean that people always showed up, but just getting the information out there was what was more important to the organization. So as I was saying, that it's important to make sure you're ready for a crisis. You can do sort of a risk assessment if you want to see what you might be at risk of whether it's financial, public safety sort of thing, and you might see some holes there. But ultimately, you don't want to stop communicating because no comment is rarely going to cut it for the media these days, unfortunately. And it's okay for you to say, I can't answer that question right now. If a reporter calls you and says, hi, I need X, Y, and Z, but you're not the right person to give that information, or you're kind of in the middle of an investigation to figure out exactly what's going on, you can say, I can't answer that right now, write down the question, and then get back to them, say, I'll get right back to you, and do so, get back to them. If it's a privacy issue, if it's a policy issue, just say, I can't give you that information because it's against our policy to do so, and they should respect that. So no comment isn't really a good answer for these types of things. But if you're ready, if you have a crisis communications plan, and you understand how it works, you should be able to get through this just fine. Any questions? Yes.
So I recently sat on a call with Yelp talking about both like the marketing aspects of Yelp, so like having an ad, placing that so you can kind of drive more traffic to your health center, and then also just the other part where you clean up your health center's presence on Yelp.
Mm-hmm.
Like, what are your thoughts on paying for that kind of support from those kind of companies. I mean, it's not terribly expensive.
Right.
A lot of it is dependent on, like, they can't really tell you how much the price is. Well, speaking for Yelp, it depends on how many clicks happen. But they can kind of give you the cap of, like, how much it would cost you at the most. But anyways, that's kind of right there. Just kind of what are your thoughts about paying for those kind of services? And same is true for, like, Facebook, for, like,
Right.
pushing posts and so forth.
So for Yelp, I don't. I'll be honest. It bothers me that they want you to pay to clean up your reputation. That, to me, that model just seems kind of shady. I don't know. I think that you can actually mitigate the stuff that's on Yelp by having other really positive presence on the internet. So being really good about updating your Facebook, being really good about commenting and answering questions, and being good about updating your Twitter, making sure your website is always up to date with information. But also, I think it's a good place, obviously, like I said, to go listen. But I don't know about the paying situation. I'd have to look more into that. I feel like Glassdoor does the same thing. But I think that if a ton of people are saying really great things about you and one person is saying something negative, more than likely people aren't going to take that one person seriously. I mean, you should look into it if it's a patient issue, customer service issue. But, you know, the rest of the web is like, these people are great, they're wonderful, they do good things. So I don't know that I would pay for that. As far as Facebook, we've used them to boost different like badges and things like that. But as far as reputation management, we haven't really done that a whole lot. And I know Facebook keeps changing their algorithm, which is really hard to keep up with at times. But I would say, you know, building a really strong following, both externally and internally, should really help you. I know that one of our weaknesses at NAC is that every time I post something on Facebook or Twitter, even though I know there's NAC staff that's on both of those, they don't always share and follow and help us, you know, get the word out. And I need to work on that. And so the more shares and retweets or whatever that you have, the more likely it is that people will see your information in their newsfeed. And so I would go more organic than I would go paid. But if there are certain things that you really want to get out there, then sure. I mean, a $5 boost, really easy to do, really quick. And you can, you know, maybe you can set a benchmark so that you know how well that did and then go from there. Does that?
That helps. Yeah.
Okay. Any other questions? No.
I have kind of a
Okay,
question.
sure.
So like back to kind of staff, like I think that's such a great resource to have. Say you have 500 staff,
Mhm.
to have all 500 staff like your Facebook
Mhm.
page, like you on Yelp. I guess this is a two-part question. One is like, do you feel like it's you have integrity if you're asking staff to like write positive things about your health center on your social media? I mean, because you have a biased view of how,
Right.
you know. But then I guess the second part of that question is the concern about having staff participating in social media. They maybe don't have their privacy settings proper on their Facebook because they are changing constantly.
Mhm.
So it's a fine balance between, as the employer, you're going to see a lot of their personal stuff that you may not want to see or definitely don't want to see. And then also using them as like the outlet to spread the word and get information out about things you do want posted.
Right. So I'm with you. I don't think that employees should go on Yelp and rate your services because that's more of a customer oriented, right? Glassdoor, you can encourage, if you think your employee is really happy about where they are, then encourage them to go to Glassdoor and leave information about, you know, how great the place is to work for. That's fine. What I think is really great is if they like your page and share the stuff that they want to share. I mean, you don't have to force them to share stuff, but just them being aware of this, you know, this week we're doing a breast cancer photo and we did this, look, it's me kind of thing, you know. I think that works well. And as far as social media use within the workspace, I manage NAC's Facebook page, and I cannot see if an employee does share something or like something, I can see that they liked it or shared it, but I cannot see anything else unless they let me. So again, it's their privacy settings. But I think that goes back to education. So having a social media policy and making sure everybody reads it. You might even want to get people to sign it that acknowledges that they've read it and looking at it. So right now we're actually revamping ours. It's taken a little longer than I'd like, but we're revamping ours because things have changed so rapidly, right? And just having people read it and understand how important it is to protect the patient's privacy, their privacy. There's certain things you don't want to share on the internet because once it's on the internet forever. And understand that. And then maybe, if people still are kind of hesitant and worried, having a brown bag training session. This is how you set your privacy settings. Simple things like that. Because I know at our organization we have a broad range of activity on Facebook and Twitter. Some people don't get it and are like, what? And my speechwriter is always teasing me about it. She's not interested. And then there's the younger crowd that does know about it, but maybe they haven't quite protected their image on social media. And I think actually your employees will appreciate that if they're ever, deciding to move on professionally or do something different, that you've helped them see that maybe there's some things that are not appropriate. Does that make sense?
Yeah.
Okay. Any other questions?
In your social media policy for staff, do you have anything about if they use it inappropriately or negatively? So we just had this actually, where a staff member it was a clinic support person who was mad at the provider they worked with because the provider told them, you need to be doing this, and they were meeting the expectations. So then they went on Facebook and they also friends. But anyway, posted something about the provider being so mean. And
Yeah.
And then, of course, then someone else commented, and we're a small community, people know
Right.
where they work, who they are, do anything.
Yeah, no, we do. We specify what's appropriate and what's not appropriate and sharing stuff that's work-related. Again, you're more than welcome to share the badges and the fun stuff and the news items that I post, but sharing stuff about your workspace, not only is it a bad idea where you work at NAC, it's a bad idea in general. That's just that's a social media no-no. And so I think people really are aware of that, and it is explicitly in our social media policy. Yep.
So where can we go to get, one, a social media policy for employees, two, a crisis management policy, which includes social media, and these crisis action plan and checklist, where can we find?
So I put together a template, and I didn't bring enough copies. So I do have one, and I'll give you my card, and I can email it to you. I'm working on the social media, I'm revamping it. My hope is to actually put together a bunch of different communications resources and get them to the PCAs so that they can distribute them. But we're in the process of sort of kind of redoing a website and putting new stuff together. And so we can have that for you as well. And I'm also developing a checklist. So, any other questions? All right. Oh.
I guess I do have one question. So we have had concerns about either disgruntled former employees or family members of employees or former employees posting gripes and complaints. One I can think of, an employee got Employee of the Year, and somebody who didn't like her, posted some nasty stuff on the Facebook page.
Okay.
About it. How do we respond to that?
So,
Do we ignore it, or do we say, hey, we don't approve of this, or, what do we say?
So on our Facebook page, we actually have a tab. It's a little harder to find, but it's actually our policy for our page. And it explicitly says to anyone who likes us that anything that's derogatory, that we deem derogatory, we're going to delete. So people post kind of random stuff sometimes, and I can't delete those. And if there's an actual concern that I feel like I can address, I will do that. But if it's something that's derogatory or aimed at somebody else, I quickly delete it. I might send, I may or may not send a message and say, oh, this is inappropriate, but I will delete those. And I also delete advertisements. So I get random people wanting to post like stuff that you guys, that think you guys need, kind of thing. And I delete those as well because our Facebook page is not it's not an advertisement page. And we know that folks don't really like that kind of information. It's not useful to you, so why have it there? And so our Facebook page policy for our followers or people like us is there, and people can read up on that. And so if something like that happens and I delete it and they say, oh, well, why did you delete this? I can point explicitly to that and say, you violated the rules. So I would recommend that. And I can create that too if you'd like. So.
When it's personal email to personal, or personal Facebook to personal Facebook though, how would you advise that provider acknowledge? So it wasn't on their health center site, it was on their personal sites, and then the provider came to me and said, what do I do about this?
If
How do you suggest that they just delete it so it's no longer there, or that they publicly say
if it's the personal provider's page, that's your personal page. If you want to delete something crazy that someone has said to you, delete them. And also advise them to unfriend that person so they can't post anymore. But that private pages, personal pages are a totally different matter, and people can decide whether or not they want something there or don't want something there. So, yeah.
How about, kind of relevant to what she's saying,
Mhm.
let's say you have an employee or provider or a patient, and they tagged you, your public Facebook page or your health center. Are you able to, as a gatekeeper, can you actually untag? Or how do you do that so that you're not associated?
Yeah, you can untag. Definitely. You can also set your settings. Yeah, you can set your privacy settings so that people can't tag you. I don't like to do that because I think it's great when people tag us, but I haven't had an incident like that yet. Yeah.
So we can also have a mechanism for
Yep. Exactly.
Because you're able to see the close report section.
Yeah.
The other privacy settings.
Yep. And you usually get, so Facebook will send you an email when something like that happens. Whoever is the gatekeeper there, they'll get that email. You get emails if you get comments and things like that, so you're aware of it right away. Any other questions? Yes.
One question just on the clarification between like a policy versus a guidance. So we've decided to kind of have a social media guidance that kind of informs employees, like these aren't smart things to do on Facebook. But we haven't come out and said like this is our policy, because if we have a policy, I think we're a little nervous around restricting people's freedom of speech and just kind of getting into that gray area, since social media is such a gray area. And then you really, like, if you have an infraction, then you have to really act on it. So how do you act on something that is changing like by the second? So what is your thought on like if a guidance is effective enough, or if you really need to kind of have a policy that kind of holds employees more accountable?
I think you need to have a policy that holds them more accountable, because if someone does something wrong and you discipline them, you don't want them to, you never know if they're going to take it to an extreme and do some legal sort of thing, because it covers the organization if something like that happens. If someone, let's say you're like 3 strikes and you're out, right? If you have that explicitly in your social media policy, and that person says, oh, I was unfairly fired or let go, then you can say, no, we told you. You have 3 strikes and you're out. Guidance, you would think that guidance would be enough, right? These are great rules for you not to do X, Y, and Z. But unfortunately, that's not always the case.
So we've had legal counsel kind of look at that, and they've suggested not to do a policy.
Really?
Very recently because of freedom of speech, and that whole employment law is changing so rapidly around social media practices that maybe they're just a too conservative view of things, but.
I've never heard of that. I think.
We've gotten similar feedback too, and to the extent where if someone complains about work, and even one other employee likes that, suddenly they're protected with, if you retaliate against that, then you're preventing them from coming together to talk about workplace complaints, like if they were from a union. So So it brings in a lot of those aspects too, so.
Wow.
Is that
Well-
specific to your work page or a personal page? Does that make a difference?
So work, I know you can type, because that's your,
Yeah.
that's your organization that you're protecting.
Right.
I think it's just, I think as long as like if work is referenced, like so say you don't say your name, but you're talking about work, it's clear you're talking about work, or you're talking about a patient, those kind of things.
On your personal page?
On your personal page, but you find out about it, because she.
And that's
made it.
exactly what
Yeah.
happened in our case, and I found out about this on the way here this weekend. So I have to deal with that when I get back, but, so it's a guide, we don't have it in policy.
Okay.
We have it in guidance or
Okay.
operating principles that you don't talk about work in your personal, or whatever social media that you use.
Okay.
But they didn't say, I work at
Right.
here, but anybody who's on there that knows them knows where they work, knows who they work with. And so is that grounds for disciplinary action to that employee or not? Because it was in guidance, not policy. And even if it wasn't policy, I'm like, what am I going to do about this?
So-
Back next week.
So I guess I'll have to go talk to our lawyers then and see what they say, but I would think that if it's I would think that if it's your private page and there are no names mentioned, you might be okay. I hesitate on the patient side of that because of no, but I mean like them talking about patient experiences just because I feel like that's more of a HIPAA violation. Like you go into a totally different realm, right? But yeah, I mean, I believe you should have a policy. However gray you make it in the middle, I don't know, but I can talk to the NACS lawyers and see what they say about that.
Well, how about if we get the policies about professionals, you're not allowed to talk.
That's interesting.
Yeah, it's so weird, but sometimes, employers are allowed to interpret professionalism, right? You can't let lawyers decide. Lawyers are risk averse. Everything's a potential lawsuit, right? Previous organizations that I worked with, LPD for legal affairs, I felt had too much influence on the president. Since everything was a lawsuit, we were allowed to be very brittle ourselves. So I just really guess caution on that side.
Okay.
I would think that if people are talking outside of work in their personal accounts or battering back and forth, they've got to also understand that maybe there's other people from work seeing those things, and it's going to tarnish their own image in their workplace. It could, not directly, but subtly tarnish whether they're performing well or not.
Mm-hmm.
There's things, remote stuff that, because you can't as a manager draw on that as a basis for the performance, but if you hear this stuff and you see this as part of the performance, somehow you get pulled into it. So they've got to be, it's about educating them to be smart and not to hurt themselves is really what it's all about.
Yeah.
That goes back to one of the things you mentioned about reputation management. So we have reputation management as an organization, but also individual, right? So I'm the person in our organization that's out in the community. So now, people see me as part of that organization. So it's like, if I do something shady,
Right.
it's going to happen. It's just sort of,
Yeah.
on that sort of, that goes back to that's also.
So I would also, just to piggyback on that, I would say that it's really important from a leadership standpoint to make everybody on your staff feel like they contribute to the overall well-being and reputation of the organization. They need to know how they fit into that and their role and how important it is for them to manage that role. And that's just something that's, part of creating a culture, right? And so hopefully by them understanding that and you giving them guidance, they will know that you shouldn't be talking about a frustration you have at work when your colleagues are also seeing that, especially if you're talking about another colleague and things like that.
So we will start a social media policy for employees. Have you ever heard of then, and we'll share that at orientation and go over all the nuances. Have you ever heard then of, and it fits within code of conduct, something specific for social media that you have the employees sign?
I have not, but that what he was saying.
That's what we've done, by legal advice and council counsel is like, do it through your code of conduct, standards of professionalism, and then if there is an incident, we use that as an education situation and do a counseling session with the staff if that's happened. And so it's not policy, it's their employee
How long?
handbook, they sign that
How long have you had that?
about a year.
And what is the employee response to it?
We've only had one incident since we did the education, and it was harmless, but it still needed to be addressed because we just, handed it out to staff, and so it's work, and we are small, everybody knows everybody in our rural area, and so, the big thing that we really try to tackle is the Facebook posts while at work. That's what we're kind of trying to tackle right now, and so what's ironic is, I'll have them as my friends, and so I can see that they're posting at 11 o'clock in the morning, and they're supposed to be working, so that's what we're trying to tackle more so than the negative comments is usage of Facebook while at work. Yes.
Yeah, a question. This last discussion might be part of the solution, but we had an experience where we had an employee on their own Facebook page have racist and derogatory commentary and opinions vented, and it came to our attention because patients called the office and complained about having seen that website and what were we going to do about it. So now that you got the free speech issue and your reputation, and it's not on your site and it's not happening in the workplace, but it's out there and it's affecting your reputation. Do you have we've resolved this, but do you have suggestions for that?
Wow. So I would always say definitely talk to your lawyers, and I'm certainly going to have to go talk to my lawyers now. But there have been some really big cases out there of similar situations, especially around, again, election time is crazy for folks, and people say some things that are, kosher, and so I have seen people fired for things like that because racist and derogatory takes it to another level, but I don't know that that's feasible for a health center. I mean, when I'm talking about cases where that has happened, it's been a big corporation, a big organization who's lawyered up, things like that. So it's something I would have to talk to my lawyers about and see what they say. But it does. I mean, again, it tarnishes your organization's reputation. Your hands are tied, right? What are you going to do? I'll definitely, I have to talk to my lawyers and get back to you all. So, sorry. Yes.
So what our standard of conduct says is that we had an attorney that we work with, and we have a disclosure form. So if anybody in our organization makes a post about our organization or anyone who works there, they have to put this disclosure form that this is our opinion, not the opinion of our organization, below that. And then it stopped people from posting about it. So that's been helpful.
Okay. No, that's great.
That's for your employees.
Yeah, for our employees. So if they're going to make a post on their personal Facebook page about our organization, they have to say this is not the opinion of the community health center. And it would apply to employees also. It's their own personal opinion.
But that's not for sharing, because one of the things we try to do is have our employees share, not share, if we're going to have a health fair somewhere, we would like them to share.
Yeah, no, and I think that that's fine. I think what she's referring to is like you have a political opinion of some sort, putting that disclaimer at the bottom. This does not represent our organizations, things like that. I've also read though, and I would have to find the article, that doesn't protect the user if something really bad happens. So if they say something too crazy. So, any other questions? All right. Well, thank you for joining me. I really appreciate it.